to the surgical field and is inserted into the working end of the light handle. This is performed after pulling the pull tab which activates the light source. As noted, the end of the rod is illuminated, and the rod as it is transferred underneath the dermis exhibits a nice amber yellow light in the space to avoid the creation of a false passage. This sequence is carried out throughout the entire sequencing from 1 to 9 until the suture swings back around the right ear and then exits through point number 1. It is important to pull the suture out to length so that the suture only has approximately 6 inches exiting from the initial insertion site. If one does not advance the suture throughout the placement of the sequence, the suture, because of its braided nature, may lock into place, and therefore it will not allow the surgeon to utilize the complete length of the 100-inch suture segment attached to the suture rod. Once again, the rod is brought out, which is the original insertion site of the suture. Once the rod is brought out through point number 1, the suture ends are then cut with a scalpel. There is just visible tension of the skin at the back portion of the neck.